NRG-HN009 is a head and neck cancer study, and these are for patients with locally advanced or local regionally advanced head and neck cancer. It's an international study, open at centers around the world, phase 2, phase 3, and these are for patients that are having radiation plus chemo for curative intent of their head and neck cancer. And the question at hand is the schedule of chemotherapy that's given with the radiation. The radiation is given for 7 weeks to 70 gray, and centers around the world have commonly given the cisplatin chemotherapy either weekly or every 3 weeks. And each center believes strongly in their heart and soul that the one they've selected is the best. We really need to know, for the sake of the patients, which one is preferred, and that's what HN009 is. It's a randomized comparison of 2 schedules of cisplatin chemotherapy delivered during the 7 weeks of curative head and neck radiation. Common inquiries about HN009. I suppose in the last year and a few months, the most common questions that come are about staging eligibility. It shouldn't be so complicated, but it is in head and neck. We have HPV positive and negative patients that can be enrolled on the study. Staging is a little bit different in those 2 entities, and so we do have a number of queries from centers about, is this stage of a patient eligible? And most of that, although it's in the protocol, I recognize it can be a little confusing, and we welcome the questions. When someone is not sure, they can just make that query. And the same for the anatomic site. The head and neck comprises some 25, 30 different subsites, and these are for patients with cancers of the oropharynx, larynx, and hypopharynx. We also accept patients with unknown head and neck primary, so it's sort of the dominant cohort of sites in the head and neck. So the question of how HN009 will affect clinicians today and hopefully in the future. As with most randomized studies, it doesn't affect the patients today until the study is complete and mature. But this study has the very strong potential to be a practice-changing study, because as I mentioned, centers around the world use cisplatin in one of these 2 schedules very commonly. And although they feel with good reason that their selection of the schedule may be the best, this study will define that very clearly. It is a large study. We're going to enroll 460 patients in the phase 2, and if we move through the phase 3, that will be 1,250 head and neck cancer patients. We will know once and for all the answer to this question that has been contentious for 3 decades. And so it is a practice-changing study potentially, and this will affect clinicians' recommendations to patients, and ultimately the major beneficiaries will be head and neck cancer patients themselves, who will know that they are getting the preferred schedule and regimen. I suppose one major element that's good to know about HN009 is that it is something I think that we owe to head and neck cancer patients and their families. These are patients who are going through very tough, challenging treatment. These are advanced head and neck cancers that have about a 40 to 50% chance of being cured overall. Some of the patients may have cure rates as high as 80 to 90%, depending on their stage and site. 7 weeks of radiation to 70 gray is quite toxic. They have difficulty with speech, swallowing, taste, dryness of the mouth, etc. The chemotherapy also has a spectrum of side effects. We really want to know for these patients which one is the best in terms of survival and which regimen is the best in terms of diminishing the side effects. And that is what this trial is powered to do. So it is a foundational trial for patients, the thousands of patients every year that receive head and neck radiation around the world. One last comment I would make is that We are making a supreme effort to have this trial opened at centers around the world. And about every month we open it at a new center. We just are opening now in Ireland. We're open at multiple centers in Canada. We have a major center in India getting ready to open the trial, centers in South America. So this trial can really reflect worldwide practice of head and neck cancer for people receiving radiation and chemotherapy, and that is a very powerful aspect of the study as well.